welcome to Good Nurse. I'm Nurse Ashley, and today we're focusing on administering medication safely and recognizing side effects, one of the core responsibilities you'll face both in nursing school and on the NCLEX. Remember, this content is for educational purposes only and is not a substitute for professional medical advice. When it comes to the NCLEX, it's not just about knowing drug names, it's also about understanding how to give medication safely, what to watch for, and which actions to take if something goes wrong. By the end of this video, you'll feel more confident in applying the 5 rights of medication administration, recognizing common side effects, and selecting the best response to medication errors or adverse reactions in test scenarios. The NCLEX often tests your grasp of medication safety principles through scenario-based questions. You might get a question about a nurse preparing to give a high-risk medication like insulin or an anticoagulant, and the test wants to know if you'll verify the dose or recognize a dangerous sign after administration. Safe medication administration is all about preventing harm and promoting patient well-being. The exam wants to see if you can go beyond memorizing facts and apply critical thinking to keep patients safe. Let's start with the foundation, the 5 rights of medication administration: right patient, right medication, right dose, right time, and right route. These are so fundamental that the NCLEX loves to revisit them in various different ways. Number 1, right patient. Always verify the patient's identity using 2 identifiers, like their full name and date of birth. Never rely solely on them saying, "Yes, that's me." Double check wristbands and medical records. The test might also present a scenario where 2 patients in adjacent beds have similar names. Ensuring the correct patient is key to avoiding a catastrophic error. Number 2, right medication. Compare the medication label to the order at least 3 times. When you first pick it up, before preparing it, and before administering it. The NCLEX might show you a scenario where the medication name is similar to another drug. The question could be, what's the best action? The answer is often to verify the order or contact the pharmacist if you're not sure. Number 3 is right dose. Double check calculations, especially for high-risk medications like insulin, anticoagulants, or opioids. The exam might ask you what you'd do if a dose seems unusually high. Typically, verifying with another nurse or calling the prescriber for clarification is the safest step. The NCLEX wants to see if you'll pause before giving a suspicious dose. Number 4, some medications need precise timing for maximum effect. Antibiotics often need consistent intervals to maintain therapeutic levels. Pain medications should align with the patient's needs and pain cycles. If the test shows a scenario where a med is due now, but the patient is off the unit for a test, it might ask you how to handle timing. Often, the correct approach is to safely administer the med as soon as possible when the patient returns, or clarify with the provider if timing is critical. Number 5 is right route or route. Make sure you're using the correct route: oral, IV, subcutaneous, intramuscular. Misadministering a drug via the wrong route can be deadly. The NCLEX may describe a situation where a patient cannot swallow pills and you must identify whether a medication can be crushed or given in an alternative way. Understanding the correct route is key. Beyond these 5, some references add more rights to the right documentation, right reason, right response. Documentation matters because if something isn't recorded, it's as if it never happened from a legal standpoint. The NCLEX might ask you how you document a refused medication or a dose held due to low blood pressure. Clear, accurate documentation proves you're a safe and thorough nurse. Now let's talk about recognizing side effects and adverse reactions. The NCLEX doesn't expect you to memorize every possible side effect of every drug, but it does expect you to know patterns and priorities. Common themes include opioids. For opioids, you want to watch for respiratory depression, which is a low respiratory rate, sedation, and constipation. If a patient's respiratory rate drops after receiving morphine, what's your priority? usually assessing their airway, providing supportive measures, and considering reversal agents like naloxone if indicated. Anticoagulants such as warfarin or heparin, bleeding is the big risk with these. Bruising, bloody stools, unexpected bleeding from IV sites are all red flags. The exam might present a scenario where a patient on heparin shows you a sign of bleeding gums, asking you what to do next. You'd likely hold the medication and notify the provider. The next category is insulin and hypoglycemic drugs. Hypoglycemia is the primary concern with these. Symptoms can include confusion, sweating, and tachycardia. If the NCLEX gives you a patient with a blood sugar of 50 milligrams per deciliter who's alert but shaky, the safest step is often to provide a quick source of glucose. The next category is antibiotics. Allergic reactions and GI, gastrointestinal upset, are common with these. If a patient develops a rash or difficulty breathing after a new antibiotic, think allergic reaction or anaphylaxis. The test might ask your first action. Often stopping the infusion and notifying the provider is correct, along with supporting their airway and breathing if it's severe. Diuretics are the next category, such as furosemide or Lasix. There is a risk of electrolyte imbalance with these, particularly low potassium, and it's key to remember this. The NCLEX may present a patient with muscle weakness and arrhythmias after starting furosemide. Recognizing this as hypokalemia and considering whether to hold the dose and report to the provider will be key. For high-risk medications, the NCLEX may test your knowledge of double check policies. For instance, insulin often requires a second nurse verification. The exam may show a nurse preparing insulin and ask what step ensures safety, and the answer would be having another nurse verify the dose before administration. And two other examples of this would be administering a blood transfusion or initiating a patient-controlled analgesia pump. So medication errors happen, but how you respond can save the patient's life. If the NCLEX presents a scenario where you've given the wrong dose, what do you do first? Patient safety is always priority number one, and assessing the patient for harm. Then notifying the provider, and then documenting the error. The exam wants you to take accountability and act ethically. Now, let's move into some practice questions to solidify these concepts. I'm going to read scenarios and possible answers and give you a moment to think. Then we will explain the rationale. Practice question 1. You are preparing to administer an antibiotic IV. The patient suddenly reports itching and difficulty breathing within a few minutes of starting the infusion. What's your best initial action? A. Stop the infusion immediately and assess the patient's airway and breathing. B. Slow the infusion rate and see if symptoms improve. C. Administer diphenhydramine or Benadryl and continue the infusion. D. Notify the provider after finishing the infusion. So the correct answer is A. I kind of already alluded to this. Stop the infusion and assess airway and breathing. Difficulty breathing suggests an allergic or anaphylactic reaction. The NCLEX expects you to recognize that continuing the infusion could worsen the reaction. Always prioritize airway and breathing and halt the offending agent at once. Practice question number 2. A patient on warfarin therapy has a sudden nosebleed that won't stop. What's your best action? A. Apply pressure to the nose and check their recent INR results. B. Tell the patient to keep blowing their nose until it clears. C. Give an extra dose of warfarin to stabilize blood levels. D. Tell the patient to sit up and wait 15 minutes to see if it stops. The correct answer is A. Apply pressure and check INR. For a patient on warfarin, a nosebleed can indicate elevated INR levels and excessive anticoagulation. The NCLEX expects you to think bleeding risk and contact the provider if necessary. Do not give more warfarin and don't just wait. Act by applying pressure and investigating further. Practice question 3. You're about to administer a subcutaneous insulin injection. The dose seems higher than usual. What should you do? A. Give it anyway. It's what the prescription says. B, double check the order and verify with another nurse. C, ask the patient if they've taken a high dose before. D, call the pharmacy after administering the medication to verify safety. The correct answer is B, verify with another nurse or clarify the order if unsure. For high-risk meds like insulin, the NCLEX wants you to safeguard patient safety by ensuring the dose is correct before giving it. Asking the patient doesn't replace proper verification, and giving it anyway is dangerous. These practice questions highlight that safe medication administration isn't just memorizing drug facts or side effects. It's applying critical thinking, following protocols, and knowing when to pause and double check. As you study for the NCLEX, focus on the logic behind medication safety. Why do we double check insulin? Because a minor dosing error can cause severe hypoglycemia. Why do we stop an infusion if a patient's respiratory status changes? Because safety supersedes completing the dose. If you know the rationale, you'll consistently pick the safest, most patient-centered answer. Remember, safe medication practice and awareness of side effects are not just book knowledge, they're practical skills that translate directly into better patient outcomes. The NCLEX tests this because it wants to ensure that new nurses entering the field can prevent avoidable harm to patients. Every time you see a medication question, think, are the 5 rights being honored? Are there red flags that require me to stop and reassess? By internalizing these principles, you'll enter the exam and eventually the clinical setting more prepared to handle whatever comes your way. Thanks for tuning in to Good Nurse. If you found this breakdown of medication safety and side effects helpful, give this video a thumbs up and subscribe for more NCLEX-focused nursing tips. I'm Nurse Ashley, and I'll see you in the next video where we'll tackle another challenging concept and make it more manageable for your exam success.